we are gathered here today in this joint press conference between the Ministry of Health and Child Care and the visiting Chinese medical experts.
因此，今天我们在这里举行中金双方的联合媒体吹风会，包括中方的抗疫医疗专家组和经卫生部。
After that extensive planning,
为了此次吹风会，我们双方也都做出了长期的计划和努力。
and the whole purpose of this exercise was to strengthen the government of Zimbabwe's response to COVID-19.
专家组此行的目的是为了分享中方经验，提升金方的抗疫应对能力。
The Chinese specialist team arrived in Zimbabwe on the 11th of May 2020 to support us as Zimbabwe on our fight against COVID-19 pandemic through the efforts made by the Office of the President and Cabinet.
中方抗疫医疗专家组于2020年5月11日抵达津巴布韦，此行是为了支持津巴布韦政府抗击新冠疫情。
That's why we saw the team being received by the Commander-in-Chief of the Zimbabwe Defense Forces, His Excellency President Edi Mnangagwa, before meeting with the task force.
因此，中方专家组在津巴布韦也受到了很高规格的会见，在会见我们的津巴抗疫部级联合工作组之前，还受到了姆南加古瓦总统阁下的接见。
This was a top-level invitation. And secondly, they also saw the Vice President, Honorable Mohadi, who is the chairman of the task force, interministerial task force.
可以说，姆南加古瓦总统的接见是津巴的最高级别的礼遇。之后，专家组也与由副总统莫哈迪领导的部级联合工作组进行了会见。
We were very grateful that on arrival at the airport, they were met by the Minister of Local Government and Public Works, Honorable Moyo, who is also the chairperson of the Interministerial Task Force Resource Mobilization Committee.
同时，我们也非常感谢地方政府部长亲临机场迎接中方的专家组。地方政府部也同时是我们部级联合工作组资源协调部的小组组长。
My Deputy Minister, Dr. John Mangwiro, was also present together with other senior members of our management on the 13th of May.
卫生部的副部长马圭洛也在5月13号接见了我们中方的专家组。
Just to look at the objectives of what the visit was for. The main objective was to share with us notes and experience on how we can navigate out of the current COVID-19 pandemic.
如果我们看一下中方专家组此行的目的，我们就可以了解到，专家到津巴布韦主要是分享中国抗疫的做法以及经验，帮助津方更好地应对新冠疫情。
So they shared their COVID-19 experience and expressed their desire to help Zimbabwe overcome the challenge.
因此，中方不仅大力地分享出中方的经验做法，也同时表达出希望帮助津方抗击新冠疫情的强烈愿望。
The team shared their experience with the Ministry of Health officials about the pandemic, and take-home message was COVID-19 is a community disease and everyone should be sensitized about it.
中方专家在和卫生部交流的时候，分享出了这样一个 观点，就是新冠它是一个在社区内传播的疾病，因此民众每一个人都需要参与其中。
We're very happy that they visited the Wilkins Infectious Diseases Hospital and donated the following items: 2 ventilators, 20 sets of masks, 1 box of PPE.
我们很高兴中方专家组亲临考察威尔金斯医院，并且捐赠出了医疗设备，包括2台呼吸机、20套口罩、1整箱 PPE。
During the week beginning the 18th of May to the 21st of May, they visited 4 provinces, namely Mashonaland East, Mashonaland Central, Mashonaland West, and Harare. And in Mashonaland East province, they were given a very warm welcome by the PMD, who briefed them on the services provided at Moyo District Hospital.
从5月18号起，一直到5月21号，专家组马不停蹄地走访了金的各个省市，包括东马、西马、中马省，以及在哈拉雷开展了各种交流考察活动。在东马省的省卫生局负责人还带领专家组考察了马布塞夸医院。
Moyo Hospital was built with a grant and aid from the Chinese government, and the next stop was in Marondera, where the meeting was officially opened by the Minister of State for Mashonaland East Province, Senator Apollonia Mzerengi, followed by a situational report of COVID-19 of Mashonaland East Province by the PMD.
马布塞夸医院是中方的援助项目，也是中金友好医院。在这个项目的参观考察之后，第2天专家组去到了马龙德拉，那里省长亲自出席参加了活动并致辞。同时，省卫生局长也介绍了该省应对新冠疫情所做的工作。
They also went to Mashonaland West Province, Chinoy Provincial Hospital, and in both provinces, the Chinese specialist team shared experiences which enabled them to combat the problem of COVID-19 in Hunan province, and this proved to be quite useful as it gave hope and confidence to our own people that indeed this problem can be overcome.
在西马省，专家组还到访了奇诺伊医院，在那里向医护人员和卫生官员介绍了中国抗疫经验，尤其是武汉市以及湖南省的抗疫经验。这些经验分享对于西方来说非常重要，尤其可以提升医护人员的信心，向他们表明新冠疫情是可以克服的。
I'm happy to advise that a lot of experience and exchange of notes was shared with the Chinese medical expert team. What is pleasing is the fact that the strategy being implemented in the Republic of China is more or less the same strategy which the government of Zimbabwe is employing.
我非常看到中方大力向金方提供自己的建议，同时和金方开展了积极的交流。同时，也让我很高兴看到的一点就是，中方采取的抗疫策略与金方目前的策略有许多相似之处。
It is quite pleasing to note that whilst our infrastructure is not yet 100% complete, the Chinese medical expert team is happy and satisfied with the progress and direction the country has taken in sprucing up its infrastructure for COVID-19 should it attack us in a bad way.
我觉得，对于我来说，这是一个非常好的征兆和现象，就是目前金方的医疗基础设施和资源并不完善，但是中方也表达出意愿，愿意推动金方的医疗基础设施建设，并且不断提升金方的疫情应对能力。
Furthermore, the Chinese medical expert team has made quite useful recommendations, which will be adopted by my ministry as we continue to seek ways and means that will make us ready and be able to prevent the attack and challenge posed by COVID-19.
同时，我非常高兴，专家组为我们提供了很多实用的建议。卫生部也将积极考虑并采用专家组提供的这些建议，为我们应对新冠疫情做出更多贡献。
As I conclude, I want to thank His Excellency and his Presidium team for facilitating the visit of the Chinese medical expert team, because it has left us more confident of our system and also shared the knowledge and experience which now becomes the source of information from which we shall continue to make reference as we steer the efforts of His Excellency forward. That is the desire to save lives and prevent unnecessary deaths.
最后的最后，我想再次向专家组表示感谢，同时也感谢郭大使为专家组此行所做的各种努力。专家组在金方分享的各种中方抗疫经验和做法，对于我们来说非常宝贵。金方将根据中方的分享，来及时制定相应的策略和做出相应的调整，这将帮助我们